Today I'm going to talk about how to treat left-sided neck pain. The principles I'm going to talk about could equally be used for left shoulder blade pain as well as left arm pain. I always start with the same basic principles. So the first thing I do is check the patient's motion. The way you do this, always start them back in the chair. So you have them slide their buttocks all the way back to the chair and then physically lean back against the rest of the chair. This establishes a baseline, same position every time, so you can compare before and after. Next, I'll have them check their motion. The first motion I check is to the left, rotation, and I ask them to turn as far as they can. And then I check right rotation, left side bend, right side bend, flexion, and then extension. After I check their motion, I determine what exercise I'm going to use or which mobility activity I'm going to try to alleviate their pain. A typical example with left-sided neck pain would be difficulty turning to the left, difficulty side bending, difficulty extending. And when I say difficulty, it could mean just pain. It could also mean peripheralization, where the symptoms will travel further away from the source, or it could be a loss of motion. So for example, the classic presentation of left-sided neck pain, difficulty turning left, not as much difficulty turning right. That's one of the most common things I see. The treatment that I start with, is a retraction. So I ask the patient to scoot their bottom back, physically lean back against the chair, and then lean their chest and shoulders back as far as they can behind the chair. Oftentimes the patient will look up as they're doing it, which is not what I'm asking for in the beginning. So to give a cue, I tell them to imagine someone's coming to kiss that they don't want to kiss, so they're backing up away, but they got to keep their eyes forward to see that person coming. Another common mistake, people tense up as they're trying to go backward, so I'll cue them to leave the upper back relaxed and just simply lean back as far as they can, using the chest and shoulders to guide the motion, not worrying as much about the neck. Then I'll ask them to repeat that motion anywhere between 5 and 10 repetitions. And when they're done, I ask them to repeat their motion. So I have them turn to the left. If I see a change in symptoms, which could be a decrease in symptoms, or a close approximation to the neck, which would be called centralization, or an improvement in motion, any of those, I will continue that activity, and I'll take it to the extremes to try to abolish their pain or to lead to another exercise. The majority of patients who come with the classic difficulty turning left with left-sided neck pain respond simply to a retraction motion. So before I try any other type of motion, I'll exhaust retraction and I'll have them do it anywhere from 5 to 10 repetitions all the way to 50 repetitions. And then based on the results, I'll determine if I'm going to continue that exercise or do something different. So that's the general overview of how I would treat a neck, especially the left-sided neck pain with difficulty turning to the left. The same exact principles would apply obviously if you're treating the right-sided neck pain, and they also apply if you're just treating neck pain with difficulty in extending. Retraction is the first exercise I try, and for the majority of times it's the most effective to get motion going.